Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
In this edition of Health Today, we take a look at the Ebola virus, now crippling West Africa, and how we can keep it away. A health crisis is spiraling out of control in West Africa. The Ebola virus is making a fast and deadly threat in Guinea, Sierra Leone, Liberia, Nigeria, and Senegal. 2,630 people have already died, and 5,367 have been infected. The world is watching, and leading health agencies, the World Health Organization and the Pan American Health Organization, have advised all countries to be prepared. Here at home, authorities have implemented a high-level response. An isolation unit is being constructed at the Enmore Health Center. Quarantine units at the Grantley Adams International Airport and the Barbados Port Authority have been activated. Key personnel across critical sectors are being trained to respond, and a public education campaign is underway. At a public lecture entitled The Ebola Virus Disease and Other Emergent Infectious Diseases, Dr. Corey Ford, a consultant for internal medicine and infectious disease at the Queen Elizabeth Hospital, insisted that the risk of Ebola reaching Barbados remains low, but he cautioned that a country's best defense is arming its citizens with accurate information while implementing appropriate measures to respond. Ebola is a viral illness that affects multiple organ systems in the body. It is named after the Ebola River in the Democratic Republic of Congo, formerly Zaire, where one of the first outbreaks occurred in 1976.
There are 5 types of the Ebola virus. And interestingly, they're named in the parts of the world where these things arise initially. So in Zaire, which doesn't exist anymore, I know a lot of you in the room are Afrocentric, so you know the African map very well. And you know there's no more Zaire on the map, correct? There's the Democratic Republic of Congo. And in 1976, before I was born, I may add, the Sudan virus and the Zaire virus first started. These were followed by the other viruses. And the current outbreak really highlights the fact that this first one, the Zaire virus, which is the most virulent form of the virus, is the one which is causing us the problems.
According to Dr. Ford, between 1976 and 2012, there have been 20 outbreaks of Ebola concentrated in Africa. Experts believe the fruit bat may be the natural host of the Ebola virus.
The thought reservoir is actually the fruit bat. They've never been able to, per se, culture the organism within the bats, per se, but they've been able to do other techniques, such as PCR, to identify it as the reservoir, as it is the reservoir for some other type hemorrhagic viruses, such as Marburg virus, which is also found in the same region. So bats can infect chimpanzees and gorillas and forest antelopes and porcupines.
He explained that humans contract the infectious disease through contact with infected animals or the bodily fluids of infected humans.
So the humans often handle and eat bushmeat. This is interesting, including bats, chimpanzees, and gorillas, and then it can pass from human to human.
Early symptoms include sudden onset of fever, weakness, muscle pain, headaches, and a sore throat. These symptoms, which can appear 2 to 21 days after infection, are very similar to other viral infections. These later worsen to vomiting, diarrhea, impaired kidney and liver function, and sometimes internal and external bleeding. But according to Dr. Ford, an infected person can only spread the virus when they are sick.
God forbid, Dr. Cumberbatch was ill. Let's use Dr. Cumberbatch as an example. And I went over and I communicated with Dr. Cumberbatch, and she vomited on my expensive tie. The question is, do I have Ebola? Yes or no? Talk to me. It's a conversation. Yes or no? Huh? Not yet. Did she have it? She has confirmed Ebola and she vomited on me. Good, so he fires back at me. Potentially, so that's important. So anywhere between 2 to 21 days, you can have the virus on board. So I said before, and this is important, okay? You cannot spread it until you get symptoms. So if I'm asymptomatic, I cannot spread the particular illness.
He stressed there's no specific medicine or vaccine that has been proven effective against Ebola, despite the recent use of the experimental drug ZMapp, which was administered to 2 infected American missionaries who have since fully recovered.
Our methods of managing this disease at this particular point is through providing fluids and electrolytes to the patient, providing them oxygen if required, and maintaining their blood pressure and treating infections as they come up. I keep saying, and I would always say, a patient does not present with Ebola across their forehead. They often present with other illnesses as well, which we also need to treat, which can result in their mortality.
Dr. Ford made it clear that controlling the virus does not require any drastic action, such as washing your hands in gloves, carrying your own toilet seat, or stop shaking hands. Rather, he says, infection control means breaking the chain of the virus.
So you have an infectious agent, you identify the susceptible hosts, as I did throughout the presentation. We recognize who are the susceptible hosts. You look at the port of entry, and then you define the transmission.
The experts say good hand hygiene is the best defense against infectious diseases. Here's the correct way to wash your hands.
Hand washing should be as long as the happy birthday song. So we're going to rub the hands palm to palm. And as you see our volunteers, palm to palm, we're rubbing the hands. And then we're going to turn and we're going to go the right palm over the back of the left hand and the left palm over the back of the right hand. We're going to go in between the fingers, so it's palm to palm, and fingers interlaced. And then we're going to do the backs of the fingers, the opposing palms. So we're doing this sort of motion. Lovely. We're going to clean our thumbs. Yes, the thumb is part of the hand. So you're going to rub the left thumb, and then you're going to rub the right thumb. And then the nails. I'm not sure those who have those long nails, because we need to clean those in the palm. So they are rubbed in the center of the palm and the other hand. Good. So, and at this time, your hands should be dry and very clean.
Dr. Ford ends by stressing that an outbreak requires action from everybody and a change in bad habits.
A lot of these diseases, whether emergent or re-emergent diseases, are often a result of things that we do as humans. And the spread of these diseases, especially diseases such as the flu, are often a result of things that we do and our bad practices. And it's not until we as humans correct our bad practices that we'll be better off. So safety and responsibility in your home, in your workplace, at church, on the bus, when you go to the hospital, it depends on every single one. And every single Barbadian must take responsibility for that.